It's like you're a walking time bomb. You know, you don't know when it's going to explode. It's pretty terrifying, you know.
An aortic aneurysm. Her doctors were concerned it could explode at any minute. Coming up on today's All Things Heart, how a friendship with a member of our cardiac team led her to the man who would save her life. Plus, who else is at risk?
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday, I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
And good morning. It is Thursday, March 16th. I'm Jessica Lovell in for Alexis Del Cid. Welcome back to All Things Heart. Here is what we are talking about today. Your aorta has a big job. It's the pulse of life. We hear from our patient, Irma Starr, on how she first noticed something was wrong and why for her the stakes were even higher. Plus, we go behind the mask with three incredible thoracic surgeons here at the health system who are going to let us in on what life looks like for them outside of the hospital. Who knows, you may see some of their kids in scrubs someday. We're going to also get to your questions today, so make sure you send them in to us on YouTube, Facebook, and to All Things Heart. You can find links to those right there on your screen. Irma Starr is a nationally acclaimed artist living here right in Kansas City. Thankfully, she is still creating art to share with the world after undergoing surgery for a large aneurysm on her aorta. But here's the scary thing. The American Heart Association says aneurysms can develop for many years and often have no symptoms. According to the CDC's recent statistics and studies, aortic aneurysms were the main cause of nearly 10,000 deaths in the U.S. in 2018. Irma is here with us today thanks to the cardiac team at the University of Kansas Health System, a team that gave her a huge dose of hope and reassurance during a very scary time.
It's a workshop and people come all the time.
You could spend an entire day inside Irma Starr's Kansas City workshop and still not see everything.
I reproduced that for the Nelson Atkins Museum of Art. The Smithsonian used to carry little dishes of my big dish. People collect the snowflakes.
It's packed to the gills with pieces commissioned by museums across America.
Like the World War I Museum.
And other pretty incredible places.
And then I did a wagon for the White House. So they invited us to Washington. Here it is.
And replicas of her unique creations are also sold in museum gift shops across the United States and right here out of her studio.
When the wind blows, they make...
It all spills out into a sprawling garden space meticulously tended to by her longtime husband, Fernando. It's so good to be back to doing what she loves after one of the most frightening times of her life, when Irma was diagnosed with a large aneurysm on her aorta.
The aneurysm, they told me, was like this big, and they were worried that it would explode.
And that was when her art and her heart collided. Irma reached out to the University of Kansas Health System cardio-oncologist, Dr. Charlie Porter.
Charlie is famous.
Who also happens to be a gifted artist in his own right.
He's a photographer. His pictures are so beautiful.
It's Dr. Porter who referred her to the surgeon who would ultimately perform the life-saving surgery, Dr. Greg Muehlebach.
And he said, "No, don't worry, I do this every day. I don't want you to worry, you're gonna be fine, no stroke, you're fine." When I heard that, I said, boy, Dr. Muehlebach's for me.
Dr. Muehlebach is for me. We are so pleased to have Irma Starr joining us today, along with her thoracic surgeon, Dr. Greg Muehlebach. And we're also joined by thoracic surgeons, Dr. Peter Downing and Dr. Todd Crawford. How are you guys doing today?
Great.
Yeah, nice to see Irma doing well, right?
Yes.
It sure is. Well, Irma, I have to ask you, a ticking time bomb, that is something that no one wants to hear described for themselves. That would have been terrifying. How long did you have to wait between finding out that you had this aneurysm before undergoing surgery?
Okay, so one morning I woke up and my heart was palpitating I knew something was not right. So my internist, Dr. Carney Knowlton from KU, sent me immediately to the emergency room, and the care there was, I can't describe it. It's so wonderful. There were 2 nurses, and each nurse gave me a shot in one arm and the other arm, and my heart became normal. And so, I thought I was going to go home, that they would give me some medicine and I'd be fine. Well, they kept me overnight, and they sent me upstairs to get an MRI. And they found that I had this aneurysm, and I wasn't sure even what an aneurysm was. And then we talking about removing it. And there were 2 doctors who were willing to do the surgery, but they were apprehensive a little bit about my recovery because of my age. So I loved, doing my pottery. It means so much to me, so I chose to not have the surgery and do what I love, before I died. And I lived with it for a couple of years. I thought that's how it was going to be. And then Dr. Charlie Porter called me and said, I have a great surgeon for you. I'd like you to meet him. So that gave me hope. And so my husband and I went to see Dr. Muehlebach, and he walked in, and right away I could tell he was just so, not anxious. Just that's what he does every day, to help people. And he said to me, I don't want you to worry. I do this every day. You're going to be fine. So that changed my whole life.
I bet it did. Yeah, this is my first time meeting Dr. Muehlebach myself, and he walked into the studio and kind of put all of us at ease.
No, I don't know about that.
You did. He's great. He's great. And, it's so nice to hear your experience. And Dr. Muehlebach, before I get into this, I want to know, how risky was this surgery? You said that you put her at ease. You felt, age is always a concern with any surgery. Talk to us about that.
Well, it's part of the decision about operating on an aneurysm. And so she, completing her story there, she came in I believe, 2019 and had a CAT scan done, and her aorta was measured around 6 centimeters, which is actually above the guideline number to move ahead with elective surgery. And so we're always weighing the risk and benefits of surgery versus watching, or the risk of rupture. Yeah. So they elected to watch her because they felt like her risk was higher because her age is a risk factor.
And we'll just say her age is like 20 years older than what she actually looks like. Fair to say?
That would be fair to say.
Yeah.
And so then she came back a couple years later, and it had grown from 6 to 7 centimeters. And so her risk went up even higher. And so then we became kind of caught in this bind of her risk of rupture, which is exceedingly high, to the risk of surgery, which, although high, I felt like the risk of rupture was probably higher to just sit and wait. The other issue that comes into play is how healthy is the patient. So what are your other risk factors for surgery? And Irma's very healthy. And as you can see, she's still working every day, and she's very active, and her mental capacity is excellent. So
she's got a lot of life to live.
So watching her would be, in my opinion, would have been very difficult.
So what is an aortic aneurysm exactly?
So if the aorta is the blood vessel coming out of the heart, and an aneurysm just describes that that blood vessel has enlarged. So as the vessel enlarges, the larger it gets, the higher the risk that it can rupture. And if it ruptures, obviously that's a bad thing.
Is this something Irma would have had all her life, or does it just develop randomly in a lifespan?
Probably not all of her life, although when I saw her, I don't remember scans before 2019. But clearly, this is something that has progressed over time, and there's lots of risk factors for that. But her exam in 2019 was not something that obviously developed overnight. That's something she developed over many years.
So let's do some show and tell, because we have some images that show Irma's aneurysm, what it looked like. Kind of tell us what we're looking at here in this image.
So the white part, or the bright part, is the IV contrast in her aorta itself. And for a lot of people, it'd be hard to actually imagine is that good or bad, but I'm sure the two guys sitting next to me would say that that doesn't look very good. So that aorta is significantly enlarged. And I think we have
Let's go to the
another.
next photo and see what it's, is this what it's
So that would be a normal or a close to normal aorta there in the middle, the circle in the middle, and then the circle on the bottom is the aorta going down. So the circle in the top middle is the aorta going up, the ascending aorta. And so that would be a somewhat normal exam.
So let's look at Irma's MRI.
And this would be Irma's. So the measurement of that is what becomes important also, so that the measurement is sometimes difficult on somebody when in a relative sense. But Irma is, I don't want to disclose too much, she's probably about 5 feet tall. And her aneurysm measures almost 7 centimeters. And so we do some different math or different things for people of different size, so that if somebody's 6'5" versus 5 foot tall, the aortic aneurysm size isn't always going to be the same. So at 5 feet tall, her aneurysm of over 7 centimeters puts her at an extremely high risk of rupture.
That's a lot. We have one last image I think we want to see. What are we seeing here?
That would be the same picture from the side, showing just how enlarged her aorta is compared to what the normal one going back a few frames back. So
Dr. Downey, let's bring you in. Who is most at risk for developing this?
The most important risk factors for developing an aneurysm are high blood pressure, a long-standing smoking history, and then as age increases, the risk for an aneurysm goes up as well.
So do you always perform a surgery, or does size matter here? Are there other treatment options?
So like Dr. Muehlebach mentioned, one of the most important aspects of making a decision about surgery is the aneurysm size. We have a program here that offers surveillance to patients who have an aneurysm that doesn't yet meet size criteria, but may eventually grow, and those people can get plugged into our surveillance program. Then we have a good idea of how the aneurysm may change, or if it eventually becomes large enough that we want to talk about doing surgery.
Are these typically hereditary?
They can be hereditary. A lot of times the type of abnormalities that lead to stretching of the blood vessel or enlargement of the blood vessel run in families.
Irma, any family history?
I don't know. I just don't know that answer. I mean, the reality of an aneurysm is new to me. I mean, I didn't even know of the word aneurysm, so I wouldn't have been able to ask them, have you had a scan? I don't know.
Yeah, Irma, that's probably pretty typical. You're not the first person that this would come as a complete surprise. Dr. Crawford, I want to bring this in because I think when we hear of something happening to, sometimes this can be good news when we talk about celebrities because it brings awareness. And people maybe take note and maybe ask those family history questions. But this was a huge topic of conversation last year when the death of American soccer reporter and Kansas City native Grant Wall passed away. He collapsed, died of a ruptured aortic aneurysm while reporting on the World Cup. How does an aneurysm go undiagnosed or unnoticed in someone so young? Because that sounds really concerning.
Yeah, that's an excellent question. And, this is the 20-year anniversary of John Ritter's death as well, who I think
we were talking about that yesterday.
Initially kind of shed light on aortic pathology. But oftentimes it is a silent killer, and that's because these aneurysms can grow asymptomatically for many years. And oftentimes they are discovered incidentally, routine workup for another condition, trauma. And so, with that being said, we don't always know in advance, and so we're not able to surveil them closely. Obviously, when an aneurysm has a complication such as a dissection or a rupture, it's a catastrophe. We lose control of the situation there, and you're just trying to save the patient's life at that point.
Yeah, you bring up John Ritter, and I remember he was rehearsing, and then there was a hospital right across the street. I mean, he couldn't have gotten there any quicker and didn't survive it. So how likely is surviving it if you're even able to get to a hospital quick?
Another great question. We estimate that 20 to 30% of patients that experience an aortic dissection or an aortic rupture don't survive to the hospital. Among those that do and are candidates for surgical intervention, the mortality is still 10 to 20% and even higher, depending on the center you're brought to. We know that more experienced heart centers with experienced aortic surgeons tend to have better outcomes, but even in the best hands, you're still looking at over a 10% risk of death with repair.
Once it gets to that point, it can just be simply too late. We have a QR code that we want to put on the screen for you. You can scan it right now, find out if you might be at risk for an aortic aneurysm, possible symptoms, and treatment options available. Dr. Muehlebach, Irma relies, of course, on her hands to create beautiful art. Was there any concern that the surgery would disrupt her ability to do that?
Sure. The risk of stroke in this particular procedure is higher than routine open heart surgery because we have to oftentimes do a process where we cool the body and actually turn the bypass machine off for a period of time so that we can then work on the aorta, including the blood vessels going to the brain. So her risk of stroke is increased because of that, and in today's world of aortic surgery, we've taken newer techniques to try to preserve the brain function and prevent stroke and reduce that risk of stroke. So she's at a very increased risk of stroke during the procedure, but one that we felt was acceptable given the size of her aorta.
Irma, did you notice any changes when you first got back to work? Did you notice any changes, or were you able to do your art?
Oh, yes. I just want to say, well, look, I'll answer. No, when I got home from the hospital, I got such good care at the hospital. The nurses were amazing. Dr. Muehlebach and his team came often and reassured me that I'd be okay, because I wasn't sure. I was so frightened. But he said, when he walked into the room, I always asked him, am I going to be okay, Dr. Muehlebach? They always said, of course, you're fine. So that got me through. But when I came home, I couldn't throw pots because I was so weak. But I sat in my pottery just to be here and, looked around and was thinking what I was going to make next. And I think, when you have a passion, when you love to do something, no matter what it is, you have that love for it, life becomes less stressful because you are so absorbed in what you're doing. It makes life happier, And I think, if people will get that scan and exercise and eat properly, that would be very, very helpful. And I'm just so grateful, Dr. Muehlebach. Thank you again and again and again. You're just awesome. You're awesome.
Well, we love seeing you in your element and in your beautiful space in your studio. So it's so good to see you back where you are. I want to see if we're going to have some questions from the viewers, actually. But before we get to that, I have to give a big shout out to Dr. Downey, because Sarah is watching, and she said, you saved my husband's life, who had an aortic dissection in December. No words to describe how grateful they are to you today. He's able to watch his boys grow. You are their hero. So that's that's how you're going to start your day out today, being called a hero. So just had to share that with you. Leslie wants to know, and you mentioned scans, are there any preventative scans you can do to see if you might have an aneurysm? How do you know to keep that tear from happening? Who wants to grab that?
Dr. Crawford.
Sure. Well, certainly we look at population risks, so any individual with a first-generation relative that has a history of dissection or rupture should undergo a screening CT. We also focus on the connective tissue population that's at higher risk, so patients with diseases such as Marfan syndrome, Ehlers-Danlos, Loeys-Dietz. Those patients tend to have aortic complications at lower diameters, so we follow them more closely. And then patients that are identified with aortic enlargement are then followed over time very closely to ensure that their aorta doesn't grow.
Juan wants to know, are there congenital diseases related to cardiac aneurysms?
Absolutely, there are many, and that list is growing. Perhaps the most common source of aneurysm that we don't always think about is the bicuspid aortic valve population, which is about 1% of the U.S. population. And there's certainly a 30 to 40% risk of aortic dilation among that group. So it is a fairly high percentage of patients that can develop aortic enlargement over time.
So Glenn wants to know, what can we do to prevent it? Are we just following typical heart health guidelines? Is that the best way to go about it?
Some of the most important things you can do to prevent it are to understand the family history, as you mentioned, to understand what your blood pressure is at home. Controlling the blood pressure is an extremely important way to prevent aneurysm growth and development. And then if you're able to stop smoking, if that's part of someone's lifestyle, that can be an extremely important way to prevent the disease called atherosclerosis, which can often lead to aortic aneurysms and their expansion.
Great tips, great information today. I want to get to final thoughts from all of our guests. And Irma, I'm going to start with you. Any final thoughts or messages you want to share to the care team here?
Well, I just want to say how wonderful my hospital recovery was with the between Dr. Muehlebach coming with his team every day and checking up on me and reassuring that I was going to be okay. I mean, that's a miracle in itself. And the nurses, they work so hard. I mean, just lifting someone out of bed. They're heavy. We're heavy people, and they know how to do that. And they wear these special stockings because they're on their feet every day, and the care at KU is just, what can I say? I mean, they saved my life. Dr. Porter introduced me to Dr. Muehlebach, and then family. I have two daughters, one from New York. She's getting a big award today. She's a great landscape architect. And she moved in to have me, she walked me every day like a little dog. She made sure that I walked. And she cooked, she did everything. And my other daughter, Debbie, she was there, and she bought me, she bought me this gingerbread house, which I had on the table in the room, and she gave it to me to inspire me to maybe make gingerbread houses, and now I'm making gingerbread houses. And she was there and rubbed my feet and make sure I had everything. And my son brought me soup every day because I couldn't eat heavy. It had to be cream soup, and just having people to love you and making sure that you do a good job to take care of yourself. Try to exercise, get that scan, and be happy. I think, happiness is great. So I want to thank everyone who helped me. I'm so grateful I'm alive making these pots. Thank you, Dr. Muehlebach. I love you so much.
Well, we appreciate you. I hear so much gratitude in your words and your voice, and I know you're grateful, but we're grateful for you sharing your story, and we just thank you so much. Dr. Muehlebach, final thoughts or any words to Irma?
Well, thanks, Irma, and I think Irma hits the most important point, that it's a team. And yeah, we have a lot of experienced help, from the nurses to our cardiac anesthesiologists to our intensive care doctors to the people running the bypass machine. It's a large and a very experienced and incredible team, and so that's how we get all this work done. But I think the other important point is that in today's world, we're seeing more and more of this type of surgery, and in our group, as we've been trying to stay on that cutting edge, have brought on 2 people that have expertise and fellowship training in this, which is unique in the region. So Dr. Crawford and Dr. Downey both did they actually added to their own training in aortic surgery alone. So we're very lucky to have the 2 of them along on our team.
Good hands. We're glad you're here. Dr. Crawford, final thoughts?
No, I think you know, Dr. Muehlebach hit the nail on the head there. It is a team approach, and you know, it's not just about being able to do these operations. It's about getting patients through these incredibly scary, trying times. And you know, I think this speaks to Irma's strength as an individual, you know, to overcome this challenge, because going through heart surgery, especially a big aortic operation at that age, is no easy feat. So.
God, very brave.
It takes a team, and it's
a team
nice
here and a team when you get home. I love her talking about all the, give it the shout out to all you guys, but all the people, because that's the other part of getting back to life. Dr. Downey, final thoughts today?
There's not much I can add, except that this is a important topic, and it's a big deal. And if it's something you're navigating, or you want to navigate any aspect of cardiac-related issues, everyone here at KU wants to help, and we're here to help navigate however we can.
All right, docs, thank you so much. Irma, thank you. Well, this program, of course, explores just how doctors heal and save lives. But like all of us, they have lives outside of work. So this next segment gets us up close and a bit more personal with our docs.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
All right, guys, you're sitting here all buttoned up, so professional. But let's see what's going on in your personal lives a little bit. And Dr. Muehlebach, I'm going to start with you. Let's pull up the pictures and see what you've been up to. So this is your wife, and you actually get out of the hospital on vacation. Tell us about it.
We do, yes. I think that is down in the Panhandle, probably on the Alabama side, I suspect.
Nice. I get down there every now and then. I love it. What else we got here, fam?
That's my gang, 5 kids, my daughter Audrey, then Molly, myself, my wife, my son Peter, Sam, and William.
Nice. You got a big, that's
big
a
crowd.
What are these grandchildren?
That's my second family.
That's your second family?
Yep.
Not grandchildren. They're grandchildren?
No. Well, yeah, they are grandchildren. Those are my grandchildren.
I'm not aging you at all. So they got a first family and a second
Marigold and Maverick and Mila.
Oh, I love it.
Who all live in Houston.
I love it. All right. What do we got here?
That is us. That's my gang hiking. We climbed Mount Quandary. Everybody made it. I was at the tail end because I wanted to make sure everybody got up there and be safe.
That's so big of you. You're so kind. I love that about you. Always thinking of others. Okay, Dr. Crawford, you're up next. What do we got? Family photos.
All right. Well, this is my wife and I and our almost 3-year-old son, Case, at a holiday dinner this past year.
Nice, nice. How old is he?
So he'll be 3 in April.
Oh, that's a good age. Okay, Chiefs fan, obviously. How was the celebration this year?
Well, as you see here, this is the only sweater I wear during playoff season. It used to light up, but with time, unfortunately, that feature of the sweater has failed.
I was going to say, you've got another one in there.
I've never lost a Super Bowl in that sweater.
That's what, but there's also another baby in there.
Oh, absolutely. So
let's not forget about that little one.
So in addition to moving back to Kansas City, about 2 weeks after arrival, my wife gave birth to our second, Emma Louise, who is almost 8 weeks.
All right, let's look at some Halloween pics. All right, Maverick, what's this all about? Mav and Goose.
Well, I'm Goose. The real Maverick is sitting there next to me. So, you know, I'm a little embarrassed to admit this, but my son's favorite movie is Top Gun. And he's pretty obsessed with pilots and jet planes.
No shame in that game. Top Gun, it's one of the best. All right, Dr. Downey, let's close it out with you. Where are we here? Traveling in the mountains, I guess?
In the mountains. We took a trip to Keystone Mountain in Colorado to go skiing this year. First time for everybody.
Did the kids love it?
Loved it.
They did?
Yes.
You got young
Lots
ones.
of
How
snow.
old?
They're 5, 3, and 1. That's my daughter, Mari. My wife is Korean. She's wearing a traditional dress called a hanbok.
Love it.
For New Year's.
Beautiful. Okay, and who are these our future doctors?
Those are my two sons. William is the older one, he's 5, and Luke is 3. And they wore doctor costumes for Halloween this past year.
Yeah, I think they'll grow nicely into those. So thank you guys for sharing. We appreciate
Absolutely.
it. Love to get to know you more. And thank you all for being with us today. Next week on All Things Heart.
The pain thing can be like a cycle where you anticipate the pain coming, so you stress up or you tighten up, and then the pain comes and it's worse.
The chronic pain had her living in misery, and doctors say the anxiety and stress of it all put her at an even higher risk. The connection between chronic pain and your heart next Thursday morning at 10 a.m.